Welcome to It's Your Case, presented by vetcity.com. I'm Virginie Barberet, your radiologist on demand for this week. Today's example is an 11-year-old golden retriever that has been lethargic for 2 or 3 days and showed respiratory difficulties. The patient has also been vomiting for 3 days. We are presented with a set of 3 thoracic radiographs. So let's look at the important findings on those radiographs. First, we can see marked esophageal dilation with gas. So you can see it appearing here as some radio-opaque line, which is here the dorsal border of the esophageal wall. And ventrally, we can see also this, what we call the tracheal strap sign, which is a summation of the esophageal wall and the tracheal walls, which normally are not visible, but here they are visible because we have gas on either side of them. And you can see also here the ventral border of the esophagus. So all this esophagus here is dilated with gas. You can see also it's displacing a bit the trachea ventrally. So this is a megaesophagus. We'll go back to that in the conclusions. Then the second important finding of those radiographs is the pulmonary pattern that is visible. So there are severe pulmonary change visible that appear as a diffuse increase in soft tissue opacity. It's so increased in opacity that we cannot see really well the cardiac silhouette underneath. So it's hiding or silhouetting with the cardiac silhouette. So it's quite a dense pulmonary pattern. And then we can see the air bronchograms, which are those radiolucent tubes, which are the bronchi filled with air normally, but we see them better because all the alveoli surrounding the bronchi are filled with fluid most of the time in the alveolar pattern. If we move to the dorsoventral radiograph, for example, you can see this alveolar pattern is very severe, quite pronounced on the left, but also on the right side. And you can see here again the air bronchograms and the increased soft tissue opacity, which is silhouetting with the cardiac silhouette. So we still guess the borders of the cardiac silhouette here caudally, but cranially we cannot see them really well anymore. So again, those are the signs of an alveolar pattern, meaning that we lose the delineation of the underlying soft tissue structures, and we see the air bronchograms, which is another feature of alveolar pattern. As you can see, based on the lateral projections, the alveolar pattern in that case is more severe ventrally, cranioventrally, so more affecting the cranial and middle lobes. The accessory lobe is also affected, but the dorsal lobes are less affected. So for the conclusions, to go back to the megaesophagus, we cannot be sure if this is a real one or if this is due to sedation, as sometimes the sedative drugs can induce some hypomotility of the esophagus and create this megaesophagus aspect. So this will need to be correlated with the clinical examination, the clinical signs, and if in doubt, you can repeat the radiographs, at least one lateral radiograph without sedation. But it could be real. And then we have the alveolar pattern. Because this alveolar pattern is more ventrally located, and because this dog has an history of recent vomiting, the first and main differential diagnosis would be aspiration pneumonia. So whether it's secondary to the vomiting, but it could also be secondary to the megaesophagus if the megaesophagus is a real finding and not just due to sedation. So that's really the fact that the pattern is alveolar, so the alveoli are filled with fluid, mucus, pus, etc. But also that the pattern is more ventrally located, which is quite typical for aspiration pneumonia. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.